It's important to kind of distinguish between those three different categories. The personal pet or the personal pet visitation is when a patient's own pet, a dog in this situation, comes to visit that patient, typically in an end of life or a long hospitalization, really for emotional support or that sort of aspect. That's number one. Number two, service animals, as you know, are for immediate service to one patient only, and come to the hospital and don't have contact with any other patients, and in general should not be approached or treated as pets. They're not to be petted, not to be approached. They're not to be, really cajoled or played with like you do with other animals. And then there's animal-assisted therapy, or animals in healthcare. And animal-assisted therapy is essentially a dog or an animal and human interaction in a healthcare setting in which dedicated animals and teams, the team being the animal and the handler, come into the healthcare setting in a protocolized fashion and visit different patients across the healthcare system. Now, there are other risk reduction strategies that are taken into effect, like administrative controls. For example, not letting these dogs on call or these animal-assisted therapy teams go to certain patient populations, like bone marrow transplant units, for example, or people in the intensive care units. In other words, those that are at the greatest risk of a potential infection are frequently do not have a visit from the animal-assisted therapy group.